Good morning,
You're
Ali.
concerned with stage 4 restrictions, the timing might not have been quite right. When do you think they should have been brought in?
Well, I suppose what I'd say is that we're glad that they are happening now, but the AMA had been calling it for several weeks. I think you can see by the numbers, it looks like they're cutting it fine. And, you know, the idea was always to keep the numbers under a number which the health services were going to be able to cope. Now, the number which has been thrown out there is about 1,500 or something like that. But the reality is that the health services are actually already under strain. And interestingly, the limiting factor has not been the ICU beds and possibly even just the beds. It's actually the healthcare workers getting knocked out by COVID at the moment. And so, look, really, if anybody's doubting what's going on at the moment in terms of level 4, and I do understand the level of pain there, that really Victoria is one step away from the sort of the US state situations, really, where they were getting into the thousands, and it is just very close to that. I suppose what I'd say now is that we do need to sort of gather behind Victoria at the moment. I mean, the war on COVID across Australia is really being fought at the front line in Melbourne at the moment. It really is becoming the Battle of Melbourne at the moment. And look, we just really have to lend all our support to all the Victorians, and please ask them to work together and do as well as they can to hold the line in the next 6 weeks, please.
One of the questions being asked is about whether masks are effective in preventing the spread of coronavirus. We just had the opposition for New South Wales on during their press conference saying that they want masks made compulsory in New South Wales. Do you think that that's a good move?
Look, I think the move to that, it depends on where you are in Australia at the moment. I think in South Australia, we don't have huge, we've just touched community spread. But in other areas, there probably does need to be serious consideration about a threshold. And we just need some clear guidance about that, because they probably do have some benefit in the community. I think there's a separate issue at the moment, and I'll flag this, that there is serious concern about the sort of the mask policy for healthcare workers in COVID suspects and COVID wards at the moment. I flagged that previously in Victoria there's been some sort of variability in the policies, and really, to be frank, some level of anger and frustration about the fact that on COVID wards, some of the policies have really restricted the health staff to using these masks, which are the sort of normal surgical masks, rather than these sort of P2 N95 masks, which have been, I think, overall shown to be of significant benefit. Now, it does appear that part of this is the argument about droplet versus airborne spread. And also, but there is increasing evidence, particularly overseas, really in practice, that the sort of the better N95 P2 mask will reduce your risk of a healthcare worker in a sort of a COVID suspect ward, reducing the risk from about 67% to get it with your normal surgical mask to 98% protection with one of these better masks. And I think the thing is that it has felt frustrating, because the healthcare workers are the limiting factor at the moment in Melbourne at the moment. And it feels like the idea about this abundance of precaution is not being applied, and common sense is not being applied to healthcare workers. So, look, I think the move is very much to first up get much clearer instructions about this and start to move to that. And I think the feeling has been, being frank, that a lot of healthcare workers feel as though they're being let down, and they're feeling like they're being asked to sort of take a knife into a gunfight, which is really frustrating at the moment for them, because they are really the front line and really are the heroes at the moment.
No arguments about that. The frontline workers are doing extraordinary things at the moment. But can you understand, for Victorians in particular, some people are getting frustrated with the discussion around masks. They're saying, look, if you can just tie a scarf around your face, how effective would that really be?
Look, the scarf is better than nothing, but not that great. It does escalate up in terms of ability to protect in the community. We're talking now about probabilities of you spreading it to somebody else, and you being able to inhale some droplets as well from somebody who might be COVID positive. Our scarves are clearly down the bottom of the tree at the moment, and probably not that great. I think above that are going to be things like homemade masks, which are reusable and have the advantage of being reusable and probably accessible. Then go surgical masks, and above that are these P2 N95 masks. But really, they probably should be reserved for the frontline workers at the moment, and or maybe the people who are very sick. But the thing about those ones, they really need to be fitted and fit tested regularly to make sure that they actually work, because they have to fit on your head to make sure that the droplets can't come around the side.
So in that example there was a man smoking and he pulled his mask down under his chin. That is a bad way to wear your mask, isn't it? Because then you're exposing the inside of your mask to whatever germs were on your neck.
Very, very much so, and also he's touching the mask. That's the other problem. So he's touching the mask, and then there's a possibility he puts it onto another surface as well. So look, I think the tricky bit is really you do need to keep it on and not touch the mask, and not be pulling it down for any reason really. And that's not an easy thing to do for a prolonged period of time. But the flip side is I'm hoping really this is why we get back to the fact that the level 4 restrictions at the moment, which are really about reducing that movement and mixing, are really, I think, the more definitive answer than the masks at the moment.